MOBILIZER3, the latest version of the mobile patient transportation system, which for over 20 years has helped nurses from all over the world to safely move and transport critical patients within operating rooms, ERs, intensive care rooms, and all those wards where the critical conditions of patients do not allow them to move autonomously, and the transportation from one floor to another is only possible through the assistance of 3, 4, sometimes 5 staff members. This operation, if carried out manually, may seriously damage the patient and above all increase the risk of accidents for the staff. The use is very simple. MOBILIZER3 is fitted with a push-button handset by means of which you can manage all the transfer operations: patient loading, patient unloading, height adjustment. As you can see, the patient can be transferred from the operating table to MOBILIZER3 without being touched by the operator and without any changes of his/her position being necessary. By pushing the belt out button, the belt will gently slide under the patient's back without causing him/her any discomfort. The special structure of the belt allows easy adaptation to the body shape. Once the belt is positioned under the patient's back, a slight correction might be necessary to center the patient on the table. This can be done through a very simple operation. Just push the patient in button to move the patient on the mobilizer. After that, push again the belt out button to have the belt out and proceed with the centering. As you can see, there is no discomfort for the patient. Once the correct positioning of the patient has been carried out, you can proceed with the patient loading. The folding side rails offer more safety during the loading and the transportation of the patient. Both the size of the system and the diameter of the wheels make it possible even for one single operator to move around easily also in restricted areas. During the unloading operation, MOBILIZER3 must be positioned next to the table on which the patient will be transferred. The system must then be blocked by pushing down the special pedal which you will find next to each wheel. At this point, you can fold down the side rail and proceed with the transfer operation. By pushing the patient out button, the patient will be moved from the mobilizer to the destination surface in just a few seconds without his/her position being changed. The surface you will transfer your patient to could be a CT X-ray table, a simple bed, or an operating table. A centering operation might be necessary. Have the belt retracted by a few centimeters. After that, proceed with the patient unloading. Once the position has been adjusted, you only need to withdraw the transfer belt completely and leave the patient gently and perfectly positioned at the center of the new surface. Among the different uses of MOBILIZER3 within a hospital, we have chosen to show you how you can use it in an operating room when collecting a patient in very critical conditions. You will see the patient being transferred from the operating table directly to the intensive care room, which will best show the high potential of the system. The operating room is the environment where MOBILIZER3 works the best. You will see how easily and conveniently a single operator can manage to transfer a patient. MOBILIZER is fitted with all the equipment you need to transport critical patients: an IV pole, an oxygen tank support, and a special screen support. The loading operation is extremely delicate because of the patient conditions. First of all, you need to arrange all the equipment you need for the monitoring and the carrying of the patient during the transportation phase. Once properly arranged, the system must be aligned to the surface from which the patient will be collected and then be blocked by means of one of the special pedals which you will find next to the wheels. It is of extreme importance to make sure that when transferring the patient, the transfer belt is clear of any surgical lines, catheters, or drapes that could possibly interfere. As you can see, the transfer panel is cleared of any obstruction. At this point, you can proceed by pushing the belt out button until the panel reaches the very end of its course. You will then proceed by pressing the patient in button, which will carry the patient onto the desired surface. Once the patient has been transferred from the OR table to the mobilizer, the side rails are lifted in order to assure patient security during transportation. In just a few seconds, the patient is ready to be transferred to the intensive care unit. The extraordinary ease in its use allows the nurses to move the transfer system rapidly and easily within the OR, intensive care units or wards. As follow-through during the loading of the patient, make sure that also when unloading the patient from the mobilizer, the belt is cleared of any lines, catheters or drapes. At this point, the patient is rapidly transferred from one area to another. After folding down the side rails, the mobilizer is aligned with the intensive care unit bed where we wish to transfer the patient. As you can see here, the staff is extremely attentive and makes sure that the transfer surface is clear of any obstructions. The transfer operation is concluded once the patient has been shifted from the mobilizer to his/her bed and once the belt has been completely retracted. Once the patient transfer has been completed, we recommend to clean the surface area by simply using an alcohol-based solution like those normally used in ORs. Now we're going to show you all the technical aspects of the mobilizer and its accessories. The IV pole can be positioned in the IV holes which are found in all four corners. An oxygen tank support is found below the control panel. There are folding handles installed on both sides of the mobilizer. They are used to move the transfer system laterally. Do not use the rails to move the mobilizer. There is a blue bumper which is fixed all around the mobilizer in order to protect it from any collision. One of the main characteristics of the mobilizer is that it is equipped with two folding side rails that offer protection and safety during transportation of the patient. They are easily lifted, blocked down and folded back thanks to their rapid blocking system. What you can notice as being a very important feature is the high mobility of the casters that have central lock. These are very wide in diameter, which makes it easy for the operator to move the mobilizer. The special braking system is operated from all four corners. To better maneuver the mobilizer during the transportation, you can activate the swivel block steering caster to your left on the operator's side by pushing the pedal on the black arrow. To block all the wheels during the transfer operation, push down the pedal on the red arrow side. What makes the mobilizer a unique transfer system is its special flexible transfer surface, which can be easily adapted to different body shapes and weights. This offers incredible comfort while providing excellent patient care during any of the operations performed. The surface is made of aluminium and Teflon to warrant strength and flexibility. These special belts, which are customized for the mobilizer, are made of very resistant material, are anti-static and 100% latex-free. The surface can be cleaned by using alcohol-based solutions normally used in ORs. By using the handset, you can see it is possible to raise the mobilizer from a minimum of 67 cm in height, 27 inches, to a maximum of 104 cm, 42 inches. The mobilizer is battery operated. To charge the batteries, it is necessary to connect the charge plug in the battery connector and then to the network. The charge status is indicated on the control panel. The new mobilizer incorporates a control panel with an on-off switch, battery status LEDs, as well as system status lights which signal any possible dangers. For example, should the mobilizer bump into a wall or furniture during transportation, the extended belts are fully retracted, thus avoiding expensive damage repair to the mobilizer. If the patient protective side rail is in the up position, there is a safety interlock switch on the side of the patient or on the loading side which prevents the belts from being activated. This security feature is present even if the side rail is slightly raised. Please always make sure that the side rail is flat against the bumper rail if the belts fail to advance. A minimum pressure on the base of the mobilizer is enough to activate the blocking of the actuator during the lowering phase in order to prevent any possible object from being pressed. MOBILIZER has proven to save time and labor for the operator, needless pain and discomfort for the patients, not to mention that it saves the caregiver from possible career ending for back injuries. Thank you for your attention.